How common is homicidality in schizophrenia? How common is homicidality in schizophrenia? This is an important question that many people may have. Homicidality refers to thoughts or behaviors related to harming others. It is crucial to understand how this connects to schizophrenia. Research shows that individuals with schizophrenia are at a higher risk for homicidal thoughts and actions compared to the general population. However, it is essential to note that such behavior is still relatively uncommon overall. Studies indicate that people diagnosed with schizophrenia are about 7 to 17 times more likely to commit homicide than those without the disorder. This increased risk is particularly evident when schizophrenia is combined with factors like alcoholism. For instance, in a large study of homicide offenders, approximately 5% were found to have schizophrenia. This percentage is higher than the prevalence of schizophrenia in the general public, which suggests a notable association, but it is not the majority of cases. The risk of homicidality in individuals with schizophrenia is often linked to active psychotic symptoms. These symptoms include delusions, paranoia, and hallucinations. When treatment is inadequate or interrupted, the risk of violent behavior can increase. Other factors that contribute to this risk include being young, male, having a low socioeconomic status, a history of abuse, genetic predispositions, and substance abuse. It is important to understand that random or impulsive violent acts are rare among those with schizophrenia. Homicidal behavior is more often connected to specific psychotic experiences or external stressors. From the perspective of schizophrenia symptoms and severity assessment, homicidality is considered a serious but relatively infrequent symptom. Identifying individuals at higher risk is essential. This can be done through careful clinical evaluation, focusing on active psychosis, substance use, and social factors. Proper treatment, which includes consistent medication and psychosocial support, can significantly reduce the risk of violent behavior, including homicide. Patients who have committed homicide often report that their actions were driven by forces beyond their control. They may experience commanding hallucinations or delusional beliefs that influence their behavior. This highlights the complex relationship between schizophrenia symptoms and violent actions. While homicidality is more common in individuals with schizophrenia than in the general population, it remains a relatively rare outcome. Understanding and managing risk factors through thorough symptom severity assessment and treatment is essential for prevention and care.